Digital Health Mobile.
Hi, my name's Liz Ashall-Payne and I'm the Chief Exec at Orca. Welcome to today's session, which is all about digital health apps. The title of today's session is Ambiguous Advice, Questionable Quality, Determining and Distributing Quality Health Apps. Before I get into the detail surrounding digital health solutions and health apps, I just wanted to set the scene for the world of health apps. So currently we have access to over 360,000 health and fitness related apps. And every day we see 5 million people download one of these health apps. What's also quite interesting is when we talk to healthcare professionals, they can see the opportunity with health apps too. So 80% of healthcare professionals are already using smartphones and medical apps. And over 90% believe that these apps can improve patients' health. If we just do another little drill down and have a little look at digital health apps by category, you can see that over the last few years, we've seen a significant rise in solutions that can help health condition management. And this is really where we can leverage a lot of benefits from digital health solutions. Just doing an even further drill down into those products that can help with health conditions, this is what that world looks like. So 28% support mental health, 16% diabetes, and so on. And basically, what this picture tells us is that if you can think of a health condition or a health need, there is a solution for you. The question isn't really therefore, is there a solution available? The question is there a good solution available? And what are the barriers to us using these solutions across our health and care systems? Well, there are 4 big barriers to using and taking up the opportunity of digital health. The first big barrier is awareness. People, populations, patients, healthcare professionals, healthcare systems aren't actually aware that these solutions even exist. The second big problem is access. Once you become aware that there are thousands of products available covering every single clinical condition that you could possibly think of, where do you go to access them? Unfortunately, the app stores don't work. If you type in a word like dementia, you might get 1 or 2 results found, you might get none. So access at its most basic level is a challenge. The third big barrier is trust. Trust. How can you know which products are safe? How can you know which ones are quality? And unfortunately, this trust issue is not unfounded. Our research has shown that only 15% of digital health tools meet the quality criteria that you would expect. And so we shouldn't just trust all these products. The fourth big challenge is governance. And what I mean by governance is managing any ongoing risk. So if I'm your doctor and I recommend a solution to you that I know to be safe and that I can trust, how can I be assured that it's not just safe today, but it's safe tomorrow and next week? How do we manage any future risks? And within the world of digital health solutions do update and change all the time. And so this governance is a real challenge. And it's these barriers that we at Orca have been working to break down for the last 5 years. And we've learned that there are 5 key steps in breaking down these barriers and ensuring that you can find and distribute high quality solutions to the people who need them the most. And I'm going to talk you through each of those 5 steps. So the first step sounds really basic, but you need to know which solutions are good. And this is a hard challenge. There are around about 2,500 standards, regulations and best practice guides available. So the first thing is, well, which of those are applied to which products? And the world of regulation and standards keeps changing. There are new standards and regulations emerging all the time. So you need to then know what the future world of regulation looks like. So what we've done at Orca is we've built a layered approach to accreditation and approval. This accreditation and approval process starts with the ORCHA baseline review. This is around 300 questions that we ask of a product across data, security, clinical assurance and user experience. And we take products through the ORCHA baseline review using our review engine. The review engine is a solution which allows our reviewers to know which questions they need to ask of a product and hand off to experts at key points of risk. Once a product's gone through that ORCHA baseline review, we then work with national bodies like the NHS, or in Holland and the Netherlands with the 𝐂𝐨𝐬𝐧, or in New Zealand with Health Navigator, to build their national accreditation and to understand, well, what does any additional questions need to look like? We then take products through those enhanced review components, which are additional questions, which then, once passed, lead to accreditation. Because we have this layered approach, it means that everybody can benefit from the work done through the ORCHA review. And this review process is ever repeatable. Every time the product updates and changes, we re-review, meaning that the review itself tells you about the product today and not just at a point in time in the past. Now, once you know which products are good, the second step, again, sounds very simple. You now need to tell people which ones are good. And the way in which we do this is we create digital health libraries or app libraries. We do this across the NHS. We have around about 400 digital health libraries in the NHS alone at national, regional and local level. But we also do this internationally, working across Europe, Middle East and further. These digital health libraries need to house the high quality solutions. They need to have an ability so that the end user can search, filter and find the best product, not just available, but for them and their personal preferences and needs. All of our digital health libraries enable you to do that. So you can now search using a word like anxiety, diabetes, COPD, and then filter according to your personal profile, so your age. Gender can sometimes play a role. Any impairments you may have, hearing impairment, visual impairment, cognitive impairment, what you want that product to work with, Android or Apple. Do you want it to work with your Fitbit, etc.? This allows you not only access to a good list of products, but also the best one for you. Once you've told people which products are good and they know where to go, steps 3 and 4 about working with clinicians and clinical teams. What we do here is we work with healthcare professionals who use these libraries and they get an additional feature called Orca Pro, which turns these libraries into formularies, enabling them to again search, filter and find the right product for their patient and now recommend via text message to their patient the product that they've found. Step 4 is about integrating products into pathways. So it's not enough to say, here's a list of products and here's how to recommend products. We also need to be working with our clinical colleagues to say, and this is the best product for these patients at this point in the pathway. And so that pathway integration is absolutely critical. What we've seen from the Pro accounts is that this is the biggest activation tool we have available to us. So over 70% of recommended products from a healthcare professional to a patient will result in download. So this is amazing activation to help our populations gain access to high quality solutions. Step 5 is also really important and is quite often one that's overlooked. But we need to support the ongoing sustainability of these products available to us. We need to ensure that the cost of these products is paid for so that at point of prescription there is a true prescription. The product can then continue to maintain and be on the marketplace so that we can get the value from it. What we've done with the NHS, and we're keen to do this further and wider internationally, is that we've partnered with London procurement partners to create a dynamic purchasing system which is filled with high quality solutions and can easily be procured from. These procured solutions then get placed in local app libraries and can be formally prescribed via healthcare professionals. Now, really, we need all these 5 steps to truly unlock the power of digital health. And actually, now has never been a better time. What's been interesting is with COVID, we've seen a significant increase in the number of health apps being recommended. So please do think about these 5 steps when thinking about how to drive uptake of high quality digital health. Do reach out if you want to speak to us. As I said before, we're now working across 3 continents, covering 40 million people, and we're keen to know about anybody else working in this space. Thank you very much for listening.